Hi, my name is Sophia. I'll be playing as the client.
Hi, my name is Chloe and I'm going to be playing as the nurse.
Okay. I'm Rachel and I'll be the respiratory therapist.
Hi, my name is David. I am the doctor.
And then Jaina will be the nutritionist on telehealth.
Just start? Okay. Hi, good morning. I'm your nurse, Chloe, and can you please state your name and date of birth?
Sophia Branch, October 12th, 1962.
Okay, I'm going to be doing my hand hygiene. I'm going to be checking your armband. Okay, thank you. How are you feeling today?
Hi, I'm feeling a little lightheaded today.
That happens sometimes. It's one of the side effects of taking furosemide, which is a diuretic. And the purpose of that is to cause fluid loss, and that can make you feel lightheaded. I'll take note of that. Have you been keeping track of how much you are drinking?
I try, but I don't really know if I'm drinking enough.
It's important to stay hydrated while you're on furosemide. Let's talk with your doctor about your fluid intake.
Hello, good morning, Mrs. Branch. I'm David Abreu. How are you feeling today?
I'm okay, but I'm feeling a little lightheaded and dizzy. I think it has to be from the medicine.
Yeah, this can happen with this medication. One of the side effects of furosemide is that it can lead to electrolyte imbalance and dehydration. Let's take a look at your current fluid intake and talk about some lifestyle changes.
I'll take your vitals and lab results from this morning for your electrolytes. Look stable for discharge.
Alright, there are certain drugs to be cautious about when taking NSAIDs like ibuprofen that may inhibit a diuretic response. When you're sick and taking antibiotics like gentamicin, that can cause hearing loss. So when you're experiencing these symptoms, be sure to contact me. But if you're having an allergic reaction, stop the medication and see me. If you see any blisters or painful rashes, red rashes on the skin, throat, and genitals, these are indications of Stevens-Johnson syndrome, which is a medical emergency.
In addition, be sure to monitor your weight and log your intake and output as well as skin turgor. We also advise you to wear compression stockings to prevent edema. And here are compression stockings for you. You want to check for edema by pressing on your legs, and furosemide may also make your skin sensitive to sunlight, so plan to avoid prolonged sun exposure, wearing protective clothing such as sunglasses, and wearing sunscreen. You want to also notify the provider if you experience any dizziness, lightheadedness when getting up quickly to prevent falls, but to also prevent orthostatic hypotension. Next, we're going to call the nutritionist via video call.
Hi, good morning everyone. This is Dr. Verdon here, and Mrs. Branch, I would like to talk to you today about what kind of a diet you will be on while taking furosemide. So, while taking furosemide, we want you to be on a diet that is high in potassium, and this is because furosemide excretes it from the body. So, foods that are really great sources of potassium are bananas, spinach, and sweet potatoes. And we would also like to be cautious about your sodium intake as well, as that can help manage your fluid balance.
Gosh, I love bananas, and yes, I understand. So foods high in potassium and low in sodium.
Thank you, Dr. Verdon.
Alright, next we're going to have some RT consult to check on your lungs so you'll be safe for discharge.
Okay. Hi, Miss Branch. I am the respiratory therapist. My name's Rachel. I know that furosemide can affect your breathing. How are you feeling today?
I'm feeling fine, but I do feel short of breath occasionally.
Okay, let me just listen to your lungs. Just take a deep breath every time I move my stethoscope. Okay, I'm gonna check on the near back as well. Same thing. Okay, you can sit back. I didn't hear any adventitious breath sounds, and they're clear to auscultation bilaterally, which just means that there's no more fluid in your lungs, so that is good. And then just tell us immediately if you're having any shortness of breath or you hear wheezing when you breathe. Okay?
Okay, thank you so much. Thank you all for taking care of me. I'll keep these things in mind while taking furosemide.
So we want to check for your understanding. Can you repeat back what we have said to you about furosemide today?
So some things I understand is that furosemide is a diuretic and that'll make me pee a lot. I need to eat foods that are low in potassium, or that it can cause low potassium in fluids, and I had to be on a diet that's high in potassium and low in sodium. Some side effects could be like sunburn or dizziness, and I had to be careful when taking antibiotics and NSAIDs with this medication. And I also had to contact Dr. Abejo if experiencing any allergic reactions and any changes in my body, and then just wear sunscreen and these compression stockings.
Sounds good. Now here's also a patient handout for
Thank you.
that you can take home.
Great, thank you.
Thank you.